Please mention in the chat box. So today's topic, we'll just briefly go through the introduction of the infection control policies and program. This is the first chapter in your textbook. Those who have the textbook, this is the first chapter, the first few pages. Okay. We'll just go through the introduction, brief introduction. So introduction, healthcare associated infection. It was earlier called as nosocomial infection, but now we call it as healthcare associated infection. It is one of the most common complications of healthcare management. Okay, it leads to increased patient morbidity, increased patient mortality, length of stay at hospital in inpatient wards that rises. Okay, the day length rises, and also the cost of hospital stay that is also increasing. So it's kind of an out of pocket expense for the patients as well. Okay. So these are the main areas where we have to bring it down. All these four pillars, we have to bring it down. Only then we can say that we are providing a quality healthcare services. Okay. So infection control and prevention provides high quality healthcare for patients, safe working environment for healthcare staffs. Okay. This and when you study this course, the entire chapter, once we cover it, the entire course, when you cover it, you will understand what are the quality we have to focus department wise, area wise in a hospital. Okay, so that you are making it safe for the patients and also the staff who are working in a hospital. Okay, so all the principles and practices of infection control in detail we will discuss in this course. Okay, this is just the introduction chapter. So all these 6 areas in depth we will discuss. Okay, the guidelines for prevention and control of infection, antimicrobial policy, surveillance policy, disinfection policy, isolation policy, policy for investigation and outbreak management. Okay. There are 2 chapters. The first chapter of outbreak management is what we will focus more on because that is given in detail. Okay. Guidelines, the basic guidelines is using PPE, personal protective equipments. Okay. Using gloves, mask, all those comes under the guidelines. Antimicrobial policy, antimicrobial stewardship towards the last one study, kind of a last chapter. Surveillance policy, we will discuss about hospital healthcare acquired infections in detail, different types of healthcare associated infection in detail. Disinfection policy, we will study about the Central Sterile Supply Department, CSSD. Okay. And then isolation policy regarding MRSA, VRE, tuberculosis. Any patient who comes in with infection, if you have an isolation ward, what kind of isolation policies you will have to follow. Yeah, outbreak infection, whenever there is an outbreak, how do you manage it? How do you, first of all, you have to understand, are you facing an outbreak or not? Okay, so we will break down those points to understand, try to understand that these many cases that we are getting, is it an outbreak? Is it an outbreak or is it something else? Okay, and once it is identified as an outbreak, what to be done next? Okay, so these are the 6 main areas of infection control that we will discuss in throughout this course. Okay. So coming to the main foundation of a infection control within a hospital, it's a hospital infection control committee, HICC. Okay. So they have to implement, they have this role that they have to implement on a annual basis, on a yearly basis, they have to implement infection control program and policies because every year some or the other minute changes do come. Okay, either the CDC, Center for Disease Control, or the WHO, World Health Organization. Okay, either the CDC or the World Health Organization, either of these two entities, or any national level health organizations or institutions, they can come up with some policies that throughout the world it has to be applied for better healthcare. Okay, so the department has to keep an eye out for these updates, and in their infection control plan on an annual basis, they also have to bring this upgradation. Okay, so annually the manual changes. Annually, the infection control manual changes. The way of practice also changes. Then we maintain a surveillance over healthcare associated infection. Surveillance, keep an eye out. What is surveillance? The main word for it, to observe, to keep an eye out, to continuously observe. Okay, a small change that you witness, immediately take action. Don't wait for the last moment for things to get complicated and then take action. In the initial phases itself, when you see the small signs and symptoms of infection, healthcare associated infection, immediately take action. Don't wait for the infection to get complicated. Okay, so that's one example. So maintaining surveillance, how do you do the surveillance? That people who are in the clinical practice, they know how to keep an eye out for certain signs and symptoms, especially when they are taking care of patients who are catheterized or who are under ventilator, who have been put under the central the who have undergone surgeries, okay, and who have central line put in them. So for these situations, you have to make sure that you are surveilling. Okay, your surveilling means always observing, so that you don't miss any signs and symptoms. Then healthcare associated infections. How do you do the surveillance? First, you identify, okay, patients who are already put on ventilator, central line, post surgery, catheterized, indwelling catheter has been put. Okay, already these patients are at risk. Okay, so identify if they have slight rise in temperature. Okay, they look tired, fatigued. Okay, any rash, identify that, report it to the nurse in charge, to the doctor, analyze it, send their blood for take a blood sample, send it to laboratory. The laboratory will investigate it. Okay, check for any microorganisms, any infectious pathogens. Okay, and when the report comes back, if there is an infection present, control it. Give antibiotics. If at all antibiotics are required, give antibiotics, correct class of antibiotics. So these are the different steps that come under uh, controlling healthcare associated infections. Then develop and implement preventive and corrective programs for infection hazards. Okay, there are a list of infection hazards. WHO, CDC, they already have given guidelines on how to prevent them. If at all it happens, how to correct them. Okay, how to implement preventive steps so that you as a staff working in a healthcare team is not propagating more infection. Okay, then advice management on antibiotic policies. It is encouraged that people who work in the healthcare department, not just the staff, clinical staffs, non-clinical staff as well, at the pharmacy level, at the administrative level, okay, they are also building up antibiotic stewardship. They understand antibiotic stewardship, and are a part of antibiotic policies. Okay, so it is not just the task of doctors who are prescribing medicines to keep a track on antibiotic policy, but also administration and also all the allied departments. Okay, they also play an important role when it comes to following the antibiotic protocols. Review and update healthcare hospital infection control team policies, procedures from time to time. Okay. The annually when you are making this change, obviously you have to review and you are updating. Okay. That comes under the first step itself. Yearly once you have to review your policies and procedures. You can't just blindly follow some rules and regulations. Policies and procedures are put in place because they have a rationale. Okay. They have a purpose to serve. Purposeless steps are not taken. Okay, when you are making policies and procedures, purposeless steps are not taken. Every policy and procedure has a purpose, has a rationale. That's the reason why it is ensured that you practice it. Okay. Health education for employees as well, training them, continuous doctors education, medical education, CME and CNE, continuous nurse education. These all are part of this point, health education for employees. Okay. Even if they have undergone training, retraining is also done. Okay, that is a responsibility of the hospital that they regularly train their staff on all these new policies and procedures. Then infection control committee, chairperson or head of the institute of the hospital has the topmost advantage when it comes to this pyramid, this organizational chart. Okay, they are the leader. Okay, whoever is the chairperson or head of the institution, it could be an administrator, CEO, owner of the hospital. Okay, anyone who is at the topmost level, they are also part of this committee. Then microbiologist. Usually in hospitals, it is the microbiologist who takes the lead. Okay. Then representative members from the management or administration, which means one member from CSSD, one member from housekeeping, one member from the security department, okay, one member from the IT sector, people who are from the administrative side, okay, who are not in the clinical side, but from the administrative side. Even the nursing department, okay. One member from all these major departments are also a part who come directly under the microbiologist, okay. Then relevant medical faculties from each and every department that the hospital serves. It could be ophthalmology, obstetrician, gynecologist, orthopedist, okay, cardiologist, diabetologist. How many services the hospital, how many clinical services the hospital has, that one member from each department will also be the part of this committee, okay. Then you have the infection control officer who have trained in courses that you are doing right now, okay, infection control, the course that you are doing, enrolled in, okay, they become the infection control officer. On spot actions they take, actionable steps they take, okay. Infection control nurse as well, and support services from the operation theater, CSSD, housekeeping, pharmacy. Support services from the operation theater, CSSD, housekeeping, pharmacy. Okay. The members from these department as well, they come under the infection control nurse because she or he trains the technicians from operation theater. Here the technicians come, not the members. Members come way above. Okay. The head of the departments and all would be the representative members. Technicians will come under the infection control nurse. Okay. So the infection control core team, okay, this team is directly associated with going to the wards, going to all the clinical areas, okay, and seeing that, uh, just a second. So next, the core team is microbiologist who leads this team. Under the microbiologist is infection control officer who reports to the microbiologist, control nurse who reports to the infection control officer who will in turn report to the microbiologist. Okay, so that is how the reporting system works. Infection control nurse will report to the officer, infection control officer will report to the microbiologist. Okay, key strategies, direct implementation, what to do, what not to do, how to check, what to check, where to go and engage with the patients. All the guidelines here the microbiologist will give to both these entities and they have to follow on. Okay. Then education and training of staff by the infection control team. So now this core team will go to different departments within the hospital, and they have the role, they have the responsibility of making sure that all the regular staffs, the regular nursing staffs, technicians, doctors, practicing clinical practitioners, okay, they all know the recent guidelines of infection control that is put into place by the microbiologist. Okay, so first they will go and see who needs training, what training they require, assess the training needs. Okay, directly you will not go and start take the class. You will first see how much knowledge they already have, what exact training they require, and accordingly you will have to form a program for it. Okay, conduct training through awareness programs, in-service education, on-job training. These are the different areas through which a continuous education is given to the staff. Okay, awareness program, everyone can be a part of it. A small seminar, webinar, conference can be, you can make such programs and they can participate. Okay, in service education, while working, we are getting trained. On job training also, while working, we are getting trained. Then organize regular training programs as per job description of the staff. Okay, the kind of training that you will give to a technician, CSST technician, is different from what the kind of training that you will give to a intern, MBBS intern. Okay, like that. So based on the job description, job profile, okay, you have to make minor small tweaks in the training programs. Then provide periodic retraining or orientation for the staff. Okay, retraining, as I mentioned earlier, once you have given a training does not mean the staff has grasped the knowledge of it. Okay, when the staff will go and practice what you have trained it, they will have a lot of doubts. Okay, and to correct those doubts, you may have to give them a retraining. So retraining is always required. Then review the impact of training. You can't just leave the after giving a health education or after training the staff. Okay, that is not the end story. Okay, you have to see how much impactful was your training. Did it actually make your staff understand what you want them to understand? Okay, so that is taking feedback or asking them questions. Okay, or assessing the way how they go back to their job profiles and do the work. Okay, so that's how you will understand what impact you had of your training. Okay. Coming to the next part of this chapter, surveillance of healthcare associated infections, a very important step. It's a very important preventive steps of hospital acquired infection or healthcare acquired infections. So it is defined as a systematic collection, analysis, interpretation, and dissemination of data about the occurrence of healthcare-associated infection in a definite patient population. Okay, you collect the data. That is, for example, just to make you understand, take ICU for an example. Okay, do you take temperature, pulse, respiration, and BP on a regular basis in ICU? If you are working in the ICU, do you take regular temperature, pulse, respiration? Do you take a note of BP, blood pressure on a regular basis? You can answer in the chat box. Yes, you have to take, right? That is called systematic collection of data. Okay, taking pulse, respiration, temperature, blood pressure, okay, and putting that into the patient's record. That's collection of data. What you are doing there is collection of data. It's first point, systematic collection of data. Okay, and then when the doctor comes, when the doctor comes, when you give this data that you have collected, okay, the record that you have collected, when you give to the doctor will go through the temperature, pulse, and respiration. The doctor will go through the temperature, pulse, and respiration, the data that you have collected from the past few days, and he or she will make the analysis. What's actually happening to the patient? Okay, is the temperature increasing? Is it going down? Is the pulse stabilizing? Is the respiration time stabilizing? Is the BP getting normal? So that is the analysis of data that the doctors will do. Okay, and they will interpret. Interpret is diagnose. Okay, the patient's temperature is rising. Rising means the patient is in a stage of fever. Okay, the respiration is rising means the patient is suffering from breathlessness. The pulse is rising means the patient is suffering from high blood pressure. Okay, so that is the interpretation, getting a diagnosis out of your analysis. Okay, and then dissemination of data. Dissemination of data, the doctor will tell the nurse, this patient is undergoing fever, this patient is having high blood pressure, this is the medication that you have to give to bring it to control. That is dissemination of data. Okay, you have a knowledge. Okay, you want people who are under you to act on your knowledge. That is dissemination of data. Okay, so in dissemination of data is about the occurrence of healthcare associated infections in a definite patient population. So this is the surveillance. Okay, collection, analysis, interpretation, dissemination. Okay, this is the basic surveillance. So what are the objectives of surveillance? Continuously monitor the incidence of infection rates, keep a note, keep a track, a report on how many patients who came in the ICU, got admitted in the ICU and still got infection. They didn't get infection. They were not having infection when they got admitted. But after staying in the ICU for 1 or 2 days, they got a new infection. Okay, so keep a track on these numbers. How many such cases have you come across? Okay, that is continuous monitoring of incidents. Then continuous monitoring of trends, detection of hospital outbreaks. Okay, this month you have seen 50 such cases. The next month you saw 60 cases. Okay, the coming up month, in the month of March, you may see 70 cases. So what is the trend? The infection rates are going high and high. Okay, you started with 50 cases, now you have 70 cases on a monthly basis. So the trend is going up. Okay, so monitor the trend. Something wrong you're doing. Your staffs are doing something wrong, that the infection rates are going up. Okay, detection of hospital outbreaks as soon as possible. So when we will teach outbreak management in detail, we will discuss about it. Okay. Providing early warning and investigation of infection problems. So this we will discuss in the chapter of healthcare associated infection. This we will discuss in the chapter of healthcare associated infection. Each different types of disease condition, healthcare associated infection, each and every early warning signs and symptoms that we have to keep an eye out for surveillance of. Okay, that we'll discuss there in that chapter. Then planning and intervention to control. Once you found the early signs and symptoms, you have to plan. The doctors will plan what to do so that the situation does not get out of control. Okay, this infection does not complicate the already pre-existing diseases of the patient. Okay. Next is prioritizing resource allocation. That is an administrative level task. Okay. When annual budgets are made in a hospital, the administration will allocate the resources. Which department will get how much money, how much budget for this financial year. Okay. So based on the high risk area, obviously the high risk areas of the hospital will usually get, by default, they will usually get higher resource allocations. Okay. Then examining the impact of interventions. Examining the impact of interventions, whatever steps, policies, procedures you are taking to prevent infection, are they actually working? Okay. Or are you just blindly putting up policies and procedures everywhere? Nobody's following it. Okay. So whatever steps, protocols, policies you make, or you make your staffs follow it, it should have a positive impact. Okay. Then gaining the information on overall quality of patient care. Making sure you take regular customer feedback, client feedback, patient parties feedback. So you will get an in-depth insight of what quality of healthcare did you provide to your patients. Okay. These are the different components of surveillance system. You have case definition. There is a specific definition for each and every disease condition. Okay. If the patient fulfills all those criteria defined in the disease condition, then only you will diagnose the patient with the disease condition. Okay. Then active surveillance of healthcare associated infection. This takes place in all high risk areas. All the high risk areas, active surveillance means ongoing. Okay. Passive surveillance is the patient has got discharged. Now the medical records department have their patient file. Okay. And they will do their secondary research. Okay. That is passive surveillance. Active surveillance means patient is right there in front of you. Patient is right there in front of you. The patient is admitted right there in front of you. You are working in the same ward where the patient is admitted. How are you going to catch any signs and symptoms as soon as possible? That is active surveillance. Okay. Passive surveillance is the patient is discharged or referred to some other hospital. And then with the case study, with the case record, you will make your passive surveillance. Okay. What went wrong? How can you treat this case if it comes again? How can you treat it better? That is passive surveillance. Okay. Then operation theaters and ICU. Okay, these are the main areas where active surveillances are a focal part. Okay, operation theaters and ICUs are the main areas where active surveillance are a focal part. Okay. So that's all for today's session. If you have any queries, you can mention in the chat box.